Hi, I'm Pat Morris, your host for the PM Talk Show. Our telecast is made possible by these fine underwriters, and we thank them very much.
Locally owned and operated by Doctors Wheat and Bubrig, the Animal Care Center in Hammond and Pet Care Center in Ponchatoula have 6 vets on staff with nearly a century of combined experience. Celebrating our 30th birthday in May, the Animal Care Center has offered a full line of veterinary services, which includes medicine, surgery, grooming, boarding, and 7 days a week emergency services. Our mission is to provide the highest quality of veterinary care in a professional, compassionate manner. The Animal Care Center and Pet Care Center, a commitment to excellence with love and care for your pet.
Hello, this is Pat Marsh, your host. We're here again on beautiful Miller Lake with the PM Talk Show, and we want to do programs that will keep you informed of different things that's happening. And today we have another very special guest, Dr. Darryl Bubrig Jr., who is a doctor of veterinary medicine at the Animal Care and Pet Care Center here in Hammond. How are you doing today?
I'm doing good.
Great, great. Welcome to our show. And I know this is the springtime of the year and people are doing things for their pets, and we wanted to bring you on to let them know about the history of the Animal Care Center, your being a co-owner of it with Dr. Wheat and everything that you do. So we're going to open up the camera and let you begin to tell us about who you are, why you're doing what you're doing, and how long you've been in business.
Okay. I appreciate the opportunity to do this, Pat. Thank you so much for inviting us on here. I think my partner, Dr. Wheat, did a segment a few months ago, and it was my turn to be in front of the camera this time. So, but just kind of to give you a history about Animal Care Center. We've been around for a long time. The clinic has actually been open for 31 years. Dr. Wheat actually went into practice with Dr. Larry Knight back in 1983. They started building the clinic while Dr. Wheat was actually still in school. So when he graduated from school, he got to hit the ground running, so to speak. And he has some real interesting stories about when they first started practice, and before they were even finished the clinic, they had people driving up in the parking lot with horses, wanting them to work on them. And our practice has grown since then. Back when the practice was first started, we did, and Dr. Knight did a lot of large animal work, and over the years, our community has changed, the demographics have changed. We don't have the dairy farms around here that we used to. Our practice used to be about probably 1/4 dairy work, and we did about 15% or so of horse work, but that segment of our practice has basically gone away. We don't do any more large animal work per se. I still own cattle personally, but we don't do any cattle work through the practice. And I think Dr. Wheat has a couple of horses that he's been taking care of for over 20 years that we still go out and vaccinate, but that's about the extent of our large animal work now. So most of our work now is pets, and we take care of any type of pet that you can imagine. I think lizards, snakes, turtles,
oh wow,
rabbits. We see occasional squirrels, but mostly dogs and cats. That's the lion's share of our practice is dogs and cats. And we have 7 doctors in our practice, and we have a combined right at 100 years of experience. Dr. Wheat graduated from LSU in '88. He went to LSU undergraduate, so he's been practicing for 31 years. Myself, I actually graduated from Tulane undergraduate and then went to LSU Veterinary School, and I graduated in '88, so I've been at it for about 26 years now. We have an associate, Dr. Laverne, who has been practicing the same period of time. She was a classmate of mine, so she has 26 years experience. I guess moving down the line, and Dr. Laverne, actually, she graduated from here in Hammond. She went to Southeastern.
Okay.
So
my alma mater.
So we actually have 2 Southeastern graduates, because our next in line would be Dr. Sutherland. She graduated from Southeastern and then went to LSU and graduated from LSU in 2006. So she's been at it for 8 years now. And Dr. Jessica Downing, her father was a veterinarian that actually practiced in Baton Rouge, but she graduated from LSU, and she graduated in 2011, and she's been with us since she graduated. So we also have an international graduate, Dr. Brewer, actually graduated from Scotland, from the University of Edinburgh. So she went to LSU undergrad and then went to Scotland for her veterinary training. And
so you have a vast array of doctors who have a lot of different skills that they bring to your business.
Yes, and our practice, we have one more doctor, Dr. Leger, who graduated in 2013, who is our most recent graduate. But the combination of having the older veterinarians and the experience that we have mixed in with the younger veterinarians that are coming out with the new skills and the new skill sets really enables us to share. They get the benefit of our experience, we get the benefit of their recent training. Right. So it's kind of the best of both worlds, I think.
Yeah, and we'd love to have all of them over the next year come in and talk about their different techniques that they use.
Sure, sure. And we have different doctors that have different special interests. Dr. Sutherland is a real cat person. She loves cats. We have, of course, each one of our doctors probably has their favorite breed of dog. So we usually have all the breeds covered. Somebody is going to like to have a special interest in your pet. So.
I've owned only one pet during my lifetime when I was a small child, and I've never owned another one. But tell me, I was always told, and I've often heard this as a child coming up to adulthood, that the equivalent of 1 human year is the equivalent of 7 dog years. Is that true, and why?
That's a pretty good rule of thumb, okay, but it's only a rule of thumb because it varies from breed to breed. Because the smaller breeds, actually it's more like a 1 to 5, but on the larger breeds it's actually more like a 1 to 10. But the 1 to 7 is kind of the middle of the road, and an average for dogs and somewhat for cats. I think cats it's more like 1 to 6, because we actually have some cats in our practice that we've taken care of over the years that have made it into their mid to late 20s. And we have some dogs that have made it to 20. So we see a lot of old patients, and that's part of how pets are changing and how veterinary medicine is changing, because our pets are living older than they used to, because we actually are able to provide much better care for them than we used to. The advances in medicines and prevention, testing. One of the things that we do now that we didn't do as much in the past was testing, routine wellness testing. We can screen animals now for different types of illnesses and diseases that you don't see. They don't show symptoms of for years, but if you run blood tests on them, you can detect those problems and you can prevent them from becoming a serious problem. We've instituted a wellness program to where we offer blood screening on every animal that comes in for annual vaccinations and an annual exam. We offer a blood screening that can detect kidney disease, liver disease, disorders with blood sugar like diabetes.
So dogs have that?
Oh yes, oh yes. Much more common than most people think, because they share the same type of diseases that we do. In our older patients, we also screen them for hypothyroid conditions. We do a thyroid test in the panel, in the wellness panel. We have a different panel for different life stages. We have a senior panel, and we also have a junior panel, and it's tailored for the specific needs that animal is going to have. So the older ones get certain things tested, the younger ones get other things tested. What we're finding out as our numbers are increasing and that we've tested more animals is that it's as high as about 25% of the animals that we test that are totally healthy looking have some issues that need to be addressed. Usually we can address it with food, basically putting them on a prescription diet that has different type of ingredients in it to benefit that particular problem. And it's a whole lot easier than drugs.
Oh, wow. And that was going to lead to another question, but I think you've already answered it. I was going to ask if, say, a dog had diabetes, would he be treated with insulin just as humans would?
Yes, that's a good question, because it depends upon the severity of the diabetes. If the diabetes is severe, they do need insulin. They're going to need insulin. If they're borderline diabetic, sometimes we can manage those with diet, just like people. People with type 2 diabetes, a lot of times, if they monitor their blood sugar and they manage their diet, they don't need the insulin injections as much. Or sometimes they don't need them at all. Usually in pets, we do a combination of things. We try diet first. We always try diet first. If that doesn't give us the results that we want, then we step it up and we actually add insulin to the regimen.
Okay, well, this is so interesting, and it's certainly you're going to have to come back. But we're going for a break, and we'll be right back with part 2.
Shelters are the best places to find a new pet.
What a perfectly beautiful little lady.
That's where you'll discover healthy, loyal, and loving animals.
Cute little rascal.
Eager to become a part of your family. A person is the best thing to happen to a shelter pet.
Oh, ladies first.
Be that person. Adopt.
This is living. Hey, kid.
To find out more, visit theshelterpetproject.org.
Welcome back to the PM Talk Show. This is Pat Morris, your host. Before the break, we were talking about the various things that animals can do. Dr. Bubrig, I'm sorry.
Yes, that's okay.
Elaborate some on the importance of a pet to a human being and some of the things that they can warn humans about and the different things that they can detect in humans.
Well, I mean, pets on multiple levels are good for people. I think that we develop a codependency a lot of times with our pets. They are, we're responsible for giving them things, and really they give us things that are really vital to our health, especially older people. Older people, a lot of times, they don't have the interaction with other people that they did earlier in life, and for a lot of older people, their pet is basically the thing that keeps them active. It gives them something to do. It gives them a sense of purpose. So I think that helps a lot. I think that a lot of people don't exercise enough, and their pet is a great avenue for them to get more activity. Pets need activity too. Pets need exercising, and it's very important for that animal-human bond to be there, and it benefits both. It's great to go out and take your dog for a walk. It's great for your heart. It's great for the dog's health. So that's something that I don't think was talked about in the past. The human-animal bond as much, and how important it was for both people's health and for animals' health.
Okay, are they able to sense different disorders in people's bodies?
They are, and that's there's some very interesting research that's going on. Actually, they have trained dogs that are helping seizure patients. The dogs are actually able to warn epileptic people that they're getting ready to have a seizure, and sometimes they can warn them in enough time for them to take medication that will stop them from having the seizure. And if that's not possible, a lot of times severe epileptic people, these dogs can warn them that they're getting ready to have a seizure and get in a safe position so that they don't hurt themselves when they fall. I can remember as a child, I worked with a man in a hardware store that had epilepsy, and he had a seizure one day and fell and pulled the cash register down on himself. Had he had a service dog that would have been able to tell him he was getting ready to have a seizure, that type of thing wouldn't happen. There are also dogs that are being trained to actually detect certain types of cancer. It's based on scent, and we don't have the sophisticated enough scent detection ourselves, and we don't have devices that work, but dogs have it built into their bodies so that they can detect it. We actually have several service dogs that we take care of that go into the nursing homes, and these dogs are very uplifting to the nursing home patients. Unfortunately, a lot of people in nursing homes don't get the visits that they should from their family, or they don't have family, and it is an uplifting thing for them when these service dogs come in for their visit, on their routine, and it makes them happy. It gives them a feeling of well-being. So there's so many different things that we benefit from our pets.
Okay, I understand that you have a large community service that you're about to embark upon.
Thank you for reminding me about that. We are getting ready to actually do a heartworm awareness campaign in our practices, and we have kind of begged a couple of our distributors and got some free heartworm tests, and for the period of time that those heartworm tests are going to last in our Ponchatoula office, we are going to offer free heartworm tests without an office visit, so they can have their animal tested for heartworms for free if they agree to get them on heartworm preventative. And we have a 6-month injection that you can give that will prevent heartworms for a full 6 months. And for the period of time while these heartworm tests last, we're going to do free testing in conjunction with the heartworm injection.
Okay, so to my viewing audience, you better get there early.
Yeah, I don't know how long it's going to last, because we're going to start it. We're going to start it actually Wednesday, which will be tomorrow, was the 9th, April the 9th, and we're going to continue it through
until it's all gone.
Until the tests are gone.
Right.
And the Ponchatoula Walmart is opening up. They're having their grand opening, I understand, on the same day. So this is going to kind of run in conjunction with that. So we expect a lot of traffic by our Ponchatoula location because we're directly across the street, and there's going to be a new signal, a new street light on Highway 51 that was not there before, and I understand that signal light is going to become operational the day Walmart opens. So now we're going to have a stoplight right in front of the clinic so people will stop and see us maybe.
Right, stop and see. You don't have to worry about a lot of traffic congestion. You just take your turn
Right.
when the lights change.
Exactly. It'll make it easier.
Right, and we are asking that you come and take advantage of that because it's a good thing for your pet. For all of the things that pets do for you, then that's the thing that you can do for them.
That's right.
Right.
That's right.
Right. You have a animal mobile that can go from place to place.
I did want to bring that up too because we have a new service that we started. It's been less than 6 months now, and we equipped a mobile van, and we have a doctor, Dr. Sutherland, who has a particular interest in doing house calls and a mobile practice. So she wanted to do it. We thought it was a great idea and a great service for our clients. And we have a pretty large client base. We have actually in our computer base, we're over 30,000 clients. Now, not all of those are active clients, but we have that many clients in the database. And a lot of them over the years, as our clients get older, not our patients, but our clients, it gets harder for them to get out and actually bring their animals in. So what we're going to do is we have the mobile service, which we can actually send the van out and do the veterinary services at home. And if it's something that we can't take care of in your home, we can transport the animals back to our clinic to where we have all of the equipment that's needed to treat them without the owner having to go through the stress and the hassle. And a lot of things don't need to come to the clinic, but you know, our clinic, we have very good equipment and instrumentation. We have digital x-rays, we have laser surgery, we have a laser therapy unit, which is something that I haven't talked about, but which is a up-and-coming technology that is treatment for pain, and it's something that speeds healing without drugs. It's the use of a specific wavelength of light that speeds up the activity of certain types of cells, and it decreases pain, and it increases the rate of healing without giving them a drug. So for a lot of our older patients are really benefiting from this treatment modality because we have people that come in and they're at their wits' end. They're wanting to put their animal to sleep, and we have many times said, well, if you really want to give one more thing a try, let's try this. And we have extended quality life for several months or even some years in certain instances because it works. It really works. It helps them. It makes them feel better.
Right, right. Well, are there any other things that you do that you'd like to share with us at this time?
We have a pretty full service practice, small animal practice. We do most types of surgery. Dr. Weed and myself both do orthopedic surgery, bone fractures, abdominal surgery, tumor removals, cosmetic surgeries when they're necessary, not cosmetic surgeries for appearance, but fixing things that get damaged and need to be fixed.
What about the teeth?
Teeth, yes, very good point. That's a much overlooked part of veterinary care is dentistry. We provide full dental services. We do dental cleanings. We do fillings, root canals. There's you know, there are a lot of things that we can do. So, you know, that's one thing that in the past I think got overlooked, and actual lack of dental care shortens the life expectancy of a dog by about 30%. Oh, wow. So it's huge, yes. And there are kidney issues, heart issues, liver issues that are all related to oral health and good oral hygiene. So that's an important part of just regular prevention to keep your animal healthy.
Right. Well, we're certainly happy that you came to share with us, and we will be bringing you back as the year progresses. And again, we want to bring all of your doctors that work under you and Dr. Wheat so that the audience can see, our audience can see the different specialties that you offer.
Yes.
Okay, so any closing remarks?
No, I mean, I just want to thank you again, Pat, for inviting me here today.
Thank you for coming.
There are lots of things that I would like to talk about, but probably forgot about. And if you bring me back, we'll try to hit the spots that we skipped.
No, well, I've told Dr. Wheat whenever he wants you, himself, or your staff to come on of other doctors, he just let me know and I'll work you in the schedule. So I'm going to give you a homework assignment. Write your stuff down next time.
Right. My other doctors are a little camera shy, so
they'll get over it.
Right.
They'll get over it.
It's not that difficult.
But people need to know because people love their pets. They really do.
Yes. And you know, I guess on a closing note, the thing that Dr. Wheat and myself care more about than anything else, and what determines whether or not we bring a veterinarian into our practice, they have to care about animals, truly, deeply care about animals. And every one of our employees and our doctors all deeply care about pets and animal well-being.
Right, and that's, on that note, we're going to say we thank you for joining us today. We ask that you continue to join the PM Talk Show because we continue to say that knowledge is important, it's powerful, and it does matter. Even in a pet's life, it does matter. This is the PM Talk Show. Please join us again. Thank you. Have a great